CCHT exam questions. The movement of fluid from the tissues toward a higher concentration of sodium in the blood is an example of osmosis. The water softener. Operates on the principle of ion exchange. Total cell volume, TCV, is an indirect measure of the performance of the dialyzer. AAMI chemical analysis of water used for hemodialysis is tested annually. National standard, based on the CTOCAI guidelines, for the urea reduction rate is a ratio greater than 65%. Name two compartments of the dialyzer. Blood and dialysate. Organization that has as a goal to improve the care and outcomes of all individuals with kidney disease is called CCHT. The functional unit of the kidney, or the structure in the kidney that does the work, is the nephron. Decreasing the patient's prescribed blood flow rate affects the rate of diffusion. Albumin is an important test that tells about the patient's status. Nutritional. Solutions that have a higher osmolarity than body fluids are called hypertonic. Patient exposure to chloramines during the hemodialysis treatment may cause hemolysis. Ultrafiltration is influenced by transmembrane pressure. The extracorporeal circuit consists of the blood lines and the dialyzer. Normal body pHs 7.35 to 7.45. A nephron is made up of a glomerulus and a tubule system. Which of the following diffuses from the patient's blood during dialysis? Urea. AAMI standard for conventional dialysate requires the total microbial count be less than 100 CFU/ml. The venous needle in an AV fistula should be placed antegrade. Substance that may be added to the municipal drinking water to make it clearer is alum. To determine the patency of an arteriovenous vascular access, the dialysis tech should initially feel for the presence of a thrill. Excess fluid is forced out of the blood and into the dialysate during dialysis by which principle? Ultrafiltration. Dwell time peritoneal dialysis is defined as amount of time the peritoneal fluid remains in the abdomen. Feed conductivity product conductivity divided by x100 is the formula calculation of percent rejection. A medication that dialyzes off easily is digoxin. What lab tests are used to monitor anemia in the ESKD patient? Hemoglobin/hematocrit. Dialysate conductivity measures the total electrical charge of a solution. The medication used to treat anemia is Epigen. The AAMI standard for endotoxin levels in conventional dialysate is less than 0.50 EU/ml. When a patient performs fistula exercises, what is the desired outcome? Enlargement of the vein. A true aneurysm can be dangerous because it may rupture and cause the patient to bleed profusely. Organization that sets the standards for dialysis water quality is called AAMI. Asepsis is defined as the absence of disease-producing organism. The medication used to improve calcium absorption is Zempler. A marker used to determine the middle molecule clearance of a dialyzer is vitamin B12. Which component in dialysate is used to correct metabolic acidosis? Bicarbonate. During dialyzer reprocessing, the blood compartment is tested to check dialyzer for total cell volume. A mixed bed D tank contains cations and anions. If the extracorporeal circuit clots and it must be discarded, it would be most important to monitor the patient's serum level of hemoglobin. Water moves across a membrane from an area of lower solute concentration to an area of higher solute concentration by osmosis. If a patient develops an infection post-transplant, the largest contributing factor would most likely be immunosuppressive medication. The dextrose used in the dialysate for peritoneal dialysis can cause hyperglycemia. The purpose of using counter current flow is to increase the rate of waste removal.